What are gallstones? Gallstones are hardened, concentrated pieces of bile that form in your gallbladder or bile ducts. Gall means bile, so gallstones are bile stones. The gallbladder holds and stores bile for later use. The liver makes bile and the bile is carried in the biliary tree. All you need to know about gallstones. Hi, I'm Dr. Ritu Sebastian, consultant medical gastroenterologist. Gallstones, referred to as cholelithiasis, won't necessarily cause any problems for you. Gallstones can become dangerous if they start to travel through your biliary tract and get stuck somewhere. They can clog up your biliary tract, causing pain and serious complications. The problem with gallstones is that they grow slowly but surely as bile continues to wash over them and leave another layer of sediment. What begins as a grain of sand can grow big enough to stop the flow of bile, especially if it gets into a narrow space like a bile duct or the neck of the gallbladder. What are gallstone symptoms? Gallstones generally don't cause symptoms unless they block the biliary system. Upper abdominal pain and nausea are the common symptoms. They can come and go or they may stay. You might develop other symptoms if the blockade is severe or prolonged. The other symptoms are fever, jaundice, and fast heart rate. What is the gallstone pain like? Typical gallstone pain is sudden and severe. You might feel it more severely after eating when your gallbladder contracts, creating more pressure in your biliary system. It might even wake you up from sleep. The gallstone pain that builds to a peak and then slowly fades is what is referred to as a biliary colic. It may last even minutes to hours. The episode ends when and if the stone moves or the pressure eases. People describe the pain as intense, sharp, stabbing, cramping, or even squeezing. You might be unable to even sit still. Where is the gallstone pain located? Your biliary system is located in the upper right quadrant of your abdomen, which is under your right rib cage. Most people feel the gallstone pain in this region, but sometimes it can radiate to other areas. Some people feel it in their right arm or shoulder or in their back between their shoulder blades. Some people feel gallstone pain in the middle of their abdomen or the chest. This can be confusing because the feeling might resemble other conditions. Some people mistake gallstone pain for even heartburn or even a heart attack. What triggers gallstone pain? If it's a major blockade, you might feel it right away. If it's only a partial blockade, you might not notice until your gallbladder contracts, creating more pressure in your system. Eating triggers this contraction. A rich, heavy, or fatty meal will trigger a bigger gallbladder contraction. The small intestine detects the fat content in the meal and gives signals to the gallbladder to contract so that bile can be released to help digest the food. What are the warning signs of gallstones? Biliary colic is the only warning sign of gallstone. This happens when a gallstone causes temporary blockade, then manages to move out of the way and let bile flow through again. Even though the pain goes away, it is important to recognize these symptoms as a warning. Once a gallstone has caused a blockade in your biliary tract, it's likely to keep happening. The same one may be hanging around the same tight spot and continue to grow. One day, a gallstone might get stuck and stay stuck. This would be an emergency. What are the possible complications of having gallstones? If a gallstone blocks the flow of bile through your biliary system, it can affect any or all of the organs in that system. Bile that cannot flow backs up in your bile ducts and the organs, causing acute inflammation, and it can even cause bacterial infections. When severe, these complications can even become life-threatening. So, what are some of the complications? Cholecystitis is inflammation of the gallbladder. Cholangitis is inflammation of the bile duct. Pancreatitis is inflammation of the pancreas. Hepatitis is liver inflammation. Septicemia is when there is bacteria in the blood. What causes gallstones? Gallstones form when there's an excess of one of the main ingredients in bile. The excess ingredient turns to sediment at the bottom of your gallbladder or bile ducts, and the sediment gradually hardens into stones. Cholesterol stones are the most common ones, pigment stones are the other. A variety of factors are involved in the process. Cholesterol. The liver extracts cholesterol from the blood to make bile. If there's too much cholesterol in the blood, then the proportions in the bile will be off. Bile needs a balance of lipids and acids to hold all the ingredients together. Excess bilirubin. Bilirubin is a byproduct of broken down old RBCs. You might have an excess of bilirubin if you have a blood disorder or if the liver is impaired to process the normal load of bilirubin into bile. Lack of bile acids. Certain diseases can cause bile acid malabsorption, which means bile acids may be lost in the stools. The lack of bile acids cause excess of cholesterol in the bile. And lastly, cholestasis or gallbladder stasis. Stasis means inactivity. If the gallbladder isn't moving the bile effectively, it's more likely to form sediments. What risk factors contribute to gallstones? A variety of diseases and conditions can affect your bile flow or your cholesterol, bilirubin, or bile acid levels. But not everyone with gallstones has an underlying condition. So, some of the risk factors include age. Gallstones take time to develop and can grow large enough to cause an obstruction. Men are more likely to get them after the age of 60. Women are more likely to get them during their fertile years, roughly between 20 and 50 years. Gender. Women are 3 times more likely to get gallstones than men. Their risk peaks and declines with their estrogen and progesterone levels. Estrogen increases their cholesterol levels and progesterone slows down gallbladder emptying. Weight. Body fat releases estrogen, so having more of it raises your estrogen levels and your cholesterol levels. On the other hand, rapid weight loss, like after a weight loss surgery, can also cause gallstones. Losing body fat quickly releases large amount of cholesterol in the blood. Genetics. If you have a family history of gallstones, you may be more likely to develop them. How are gallstones diagnosed? If you are experiencing gallstone symptoms, your doctor will investigate with blood tests and imaging. The blood tests can detect inflammation, infection, or jaundice and offer clues to which organs are affected. Imaging tests will help detect the source of blockade in the biliary tree. An ultrasound abdomen is a quick and an easy test that doesn't require any preparation. An ultrasound can find most gallstones in and around your gallbladder. But if a gallstone is stuck somewhere else in your biliary tract, you might need another test to find it. What are the other tests? MRCP, MRI imaging that creates detailed images of biliary and pancreatic system. This test can detect stones in the bile duct. EUS is endoscopic ultrasound. This is a procedure that combines endoscopy with ultrasound images of the biliary system and pancreas. This test can also detect stones in the bile duct. ERCP is a therapeutic procedure which can be used to remove the bile duct stones and even to put in a stent. Finally, what is the management of gallstones? If the gallstones never cause problems, you won't need treatment for them while being asymptomatic unless the stone size is 3 cm and larger. But if the gallstones cause a blockade in your biliary tract, it is essential to remove the stones that cause the blockade as well as the gallbladder. Once gallstones have caused blockade, they are highly likely to do so again. Most people who need treatment for gallstones will require surgery to remove them. Surgery is the only way to ensure gallstones won't cause issues for you again. Gallbladder surgeries. Cholecystectomy, which is gallbladder removal, is the only reliable long term solution for gallstones. It is one of the most widely performed surgery worldwide, usually as a laparoscopic surgery. You can live well without a gallbladder. Post surgery, the bile flows directly from the liver into the intestines. Occasionally, some people who need treatment for gallstones aren't in a safe condition to undergo gallbladder removal surgery. In these cases, cholecystostomy is an alternative. This minor procedure places a catheter in the gallbladder to drain it. Once their general health improves, they will need an interval cholecystectomy after 6 weeks.